Good morning, good afternoon, good evening, whatever time it is you're watching this. How are you? How was your week? Did you do anything fun for yourself? We went to the park. Yes, we went to the park the other day because it was so nice out. We people watched and doggy watched, didn't we? Yeah, we sat in the sun. Yeah. um, we also we went to an event Friday night, and while we were waiting for Sean, they were like, "Oh, pick out some stickers." So the first sticker I saw, it made me think of you all. So it was, yes, you can come back from burnout. So that's the whole reason we're here, right? To help prevent and work through burnout. So I saw that, and so of course I had to get that. And it was the one right on top, so it was really interesting how it worked out. But yes, we are also going to talk about. So we're going to talk about kidney cancer awareness because March is also kidney cancer awareness. We talked about choroidal cancer last week, which, by the way, make up my mistake. I realized I said women can get pancreatic cancer; they just can't get prostate cancer. All right, so I always. They're two different things, but because they're P's, I get them confused. But yes, I said that. I am clarifying that I do know that women can get pancreatic cancer, but they can't get prostate cancer. Okay. So it's also, not only is it choroidal cancer awareness, kidney cancer awareness, it is also multiple myeloma cancer awareness. But we're going to talk about kidney cancer awareness today. And then we're also going to talk about how does that affect your burnout, right? All of this affects your burnout. So we're going to talk about that too. All right. So kidney cancer. Kidney cancer is a growth of cells that starts in the kidneys. So it can be found in both adults and young children. Most common type for adults is renal cell carcinoma. And young children are more likely to develop a type of kidney cancer called Wilm tumors. Wilm tumors, I think that's how it's pronounced. It doesn't have an A on it. It's WILM. So Wilm tumors. Wilma has an A, I believe. So yes. Anyways, number of diagnoses seems to be increasing each year. But one of the reasons they believe this is happening is because imaging techniques such as CT scans are being used more often. So a lot of these diagnoses are more accidental diagnoses, which are a good thing because obviously the earlier you catch it, which they're often getting caught early, the higher the survival rate. So kidney cancer has like a 93% survival rate when it's caught early. So it has a really good survival rate. So what are the symptoms are we looking for? Blood and urine, which may appear pink, red, or cola color. Loss of appetite, pain in the side. That does not include your kids, your spouse, your colleagues, or anything like that. That's just a literally physical pain in your side. Or back that doesn't go away. Tiredness and unexplained weight loss. How do they diagnose? Blood tests and urine tests, imaging tests, and then biopsies. I will say, interesting enough, kidney cancer is staged very differently than other cancers are. Kidney cancer is staged in 3 stages instead of 4, and is based on how quickly the cancer is growing. So it's not based on how much it's spread, just how quickly it's growing. I thought that was very interesting. So yes. So how do they treat this? Surgery to remove the cancer from the kidney or the kidney itself. Obviously, if they can save the kidney, they're going to save the kidney because, with one kidney, you'll have to go to dialysis, right? Even though we can survive with one kidney, nobody wants to have to do dialysis if they don't have to. Then you have cryoablation. This is really freeze the cancer cells. They stick in a needle into the skin, into the cancer cells, and they inject cold gas into the cancer cell and freeze the cancer cell. Another way they do this is radio frequency ablation, which is same procedure but opposites. So they stick a probe in through your skin into the cancer cells, and they heat it or burn it. Okay. With electric current. They run electric current through the probe, through the needle, and they heat it and burn it. Then you have radiation therapy. You have target therapy, where it's medicine that actually medicine that targets a specific chemical that the cancer cell has, and then it blocks these chemicals, and it causes the cancer cells to die. You also have immunotherapy, which helps the body's immune system to be able to kill the cancer cells. So it kind of like puts your immune therapy on steroids, basically, and helps it do the job it was supposed to do to begin with. So yes, I will say, well, a lot of times though, they'll also use immunotherapy. Like if you have surgery, they'll do a few rounds of immunotherapy to make sure that all the cancer cells are gone from the surgery. I will say, interesting enough, granted this may have changed, when my mom's cancer had came back, immunotherapy was starting to get popular. And I don't think it's as popular as now, but it was starting. It was getting there. But her insurance, interesting enough, she had to do 2 rounds of chemo and prove that the chemotherapy did not work before the insurance company would cover the immunotherapy. So yes, granted, obviously the immunotherapy works better on your system than the chemotherapy does. In reaction, your responses to immunotherapy, your system in general, whether it works or not, your body's response to it does better than it does with chemo. So you don't have as much side effects, I should say. Interesting enough, speaking of chemo, chemo usually is resistant to kidney cancers. Or kidney cancer is resistant to the chemotherapy. It normally doesn't. Chemotherapy does not normally work for kidney cancers. Every now and then, for rare kidney cancers, they may use it. It will, work for rare ones every now and then, so it may be used for that. I know, it's crazy, isn't it? But yeah. So where does all this come in with burnout? I say all this in a sense that you need to take care of yourself. You need to, like, high blood pressure increases your risk of kidney cancer. Your job is very stressful. Of course, your blood pressure is going to go up. You're going to have high, stress does that. Stress does a lot of things. But with you, you're going to be stressed at work. That's part of your job. I'm not saying don't be stressed. Limit your stress if you can at work. Sometimes you can't. Sometimes being stressed helps you do the job you need to do. But what I am saying is take care of yourself as much as you can, whether it's at work, whether it's eating good food as much as you can. I get it, every now and then you might not, life happens, right? You might not be able to get a healthy snack or food or whatever. And so as much as I hate to say this, but yes, every now and then you're going to have to eat junk food. It happens. It's just the way of life. So little bit moderation, as less as you can as possible. Okay, one time. But I would say, in a sense, that it'd be nice to make sure your system's trained. You have your system trained in a sense that you're so used to the good food that the one time you eat the junk food because you have to, because at that point you have no other option because of what's going on in that moment, that it makes you feel like shit. And I say that in a sense because you have that, even though you're trying to get that little bit of energy or what you need in that moment, like, it'll also make you second guess and hesitate going back to that habit, if that makes sense. Because if you eat something and you're like, oh, this doesn't make me feel bad, I can continue eating this, then you're going to fall back into that old habit. So hopefully your system is trained enough that that one time that you eat that junk food, it just makes you feel like shit. And I'm sorry, but it just helps you not have to fall in that habit, but it gets you through what you need in that moment, right? So, yes. So again, I say all this because this is one of the responses of you not taking care of yourself, of you having burnout and not working through burnout. This is one of the things that can lead to is kidney disease or kidney cancer and kidney disease, but yes, kidney cancer. All right. So with that, you have, if you need someone to talk to, you have Lifeboat, the peer-to-peer with NOMV, Not One More Bet. Definitely check them out. I mean, sometimes it's just nice to have, like, if you don't have a group of friends outside that you can talk to about work or things going on at work, or they don't really understand like what you're going through or anything like that at work, check out Lifeboat with NOMV. I mean, so it doesn't necessarily mean like if you're having suicidal thoughts, you need to speak to someone. Like, it's also good for that as well. So definitely check out Lifeboat with NOMV, Not One More Bet, and the info's in the description. If you do need to have someone to talk to because you are having those thoughts, 988. You can call, you can text them, immediate response, 988. Also 741-741, same thing, you can text them, okay? So with that, inspired by an old poem, you may not know that the world needs you, but it does. For no one else can smile your smile, say your piece, shine your light. You are unique alone, and you are unique and you alone can fill your place. If you were not here to shine your light, what would happen to the pilgrims passing by your empty place in the darkness without your light to help them on their way? You may not know the world needs you, but it does. All right. Remember, what you do matters, and the world is a better place with you in it. Dear Person's Company. Right. Thank you guys for watching. Bentley thanks you as well. He participated more today. So yes, and we'll see you next week. In the meantime, go do something for you and take care of yourself. All right. Have a wonderful week.